I got 6 o'clock.
All right.
Let's begin. Call to order. Not necessary. Everyone is here, including the YIG students. And so that is good. We have Ruby and Jessica, correct? Okay, got it. And so any citizen comments? Okay, doesn't look like it. Citizen comments are closed. Any comments from supervisors? Any updates or anything? Anything you want to say? I just have a couple reminders. We have a meeting. Some of us are going to be meeting on Thursday at 3:30 at the with Professional Services Group at 6233 39th Avenue. I just want to remind everyone about that. And also on the 18th at 3:30 p.m. at the Job Center, meeting with the Goodwill representative. Right. So if you forgot to put on your calendar, just a quick reminder. Okay.
I do have
you have
something that those of us who couldn't make it to the Human Services Job Center.
Yeah, I noticed that. Yeah.
18th of September.
Oh, there's a follow-up. That's right. We should have all got an email on that.
Yeah.
Yeah.
I think so.
Well worthwhile if you haven't gone to it. I was there, and several of us were there, and very enlightening. So progress is being made. So if you have an opportunity, I would encourage you to attend. Okay, approval of the July 1st minutes. Okay, move to approve. Second by Stephens. Okay. YIG students, what say you? I know you weren't here, so Jessica, you was here, right?
Yes, she was.
Yes, she was here.
Yes or no for approval of the minutes? Yes.
Okay. Committee?
Abstain.
Abstain, you weren't here either, right?
Right.
Still.
Right, correct. Okay. All right, so we have one abstention. So I'll mark that. Whoever's taking the notes. Let's see. And so the minutes pass for July. Okay, there is a resolution for us to approve the appointment of Jeffrey Martin to serve on the Kenosha County Veterans Service Commission. I think Mr. Martin is here. Thank you for attending. Rebecca, you're going to present? Okay, very good.
So this is a resolution to approve Mr. Martin to be on our Veteran Services Committee. If you looked at his resume, it's pretty impressive. He served 30 years with the Navy, and he currently is the commander for the Twin Lakes Legion Post. So I think he's highly qualified to serve on this, and we look forward to your approval of his nomination. I don't know if you have any questions for him, but he is here if you'd like to ask anything.
Has everyone had a chance to look at the resume, and are there any questions for Mr. Martin?
Do you live out in Twin Lakes? Or
I do.
Randall, Twin Lakes, where at? Twin Lakes?
Sorry,
Twin Lakes?
yes.
Okay.
Yeah, my last duty assignment was at the naval station down there. And I did not want to live in Illinois. So I found Twin Lakes. I've been there since 2011.
Oh, okay.
Okay.
All right, we're at.
East Lake Shore Drive,
Yep.
down there from Sandbar.
We redid, okay, you're right by the Sandbar.
Mhm.
Okay, got it. That's not too far. I'm not, that's not my district, but it's almost right there.
Okay.
It's right there. Yeah, so Aaron Carroll would be your Kenosha County supervisor, as well as he's a trustee on Twin Lakes, Board of Twin Lakes, the Village of Twin Lakes. So, okay.
Anyone else have any questions for Mr. Martin or comments? Do I have a motion? Move.
Second.
Second, okay. Did you get all that? Are you, okay.
We're watching it.
Oh, okay, now I get it. Okay, I didn't see you writing anything down. Okay, you're gonna go over it later. Okay. Okay, so we have a first by Supervisor Kirby, a second by Supervisor Poole, I'll mention it anyway. All those YIG students, what say you? Yay or nay? Yeah, okay. Committee? Aye. Okay. Resolution passes. It'll go before the county board in a couple weeks for the final vote. You're welcome to attend as well. Not required, but certainly recommended.
Okay,
So you passed the first step.
all right.
All right,
Thank
thank
you.
you for coming.
Thank you.
Appreciate it.
Thank you.
Okay, moving on. The 2026 budget update. Rebecca Dutter is going to give us some more info on the impending budget.
Sure. I don't have a ton of updates since we talked last, but I can give you just a couple of things. We were able to meet with the county exec this week, and I think we put forward a budget that is really based on knowns. You know, there's a lot of uncertainty out there. We felt that it was prudent just to deal with what we know, and then we can always go back and ask later if something changes. But since it's changing so rapidly, we wouldn't have been able to keep up with it anyways. The best update that we received was in the governor's budget. He changed the youth corrections rate from $2,500 a day to $500 a day.
Oh, that's a big
Wow.
difference.
So that saved our budget well over $2 million. Now,
Wow.
with that said, we still don't want our judges sending people to corrections if they don't need to go based on that. But it certainly had a huge impact on our budget and what we were able to fund in the 2026 budget. In public health, we had some reductions that we already knew and pretty much prepared. One of them in our emergency preparedness grant. But it's going to be reduced by about $30,000. We're able to make up that difference. And we had heard from the state that there's plans for them to reimburse that extra $30,000. But again, we did not put that in our budget because we don't have confirmation.
And that was
of that.
30,000 for what again? I didn't get.
For emergency preparedness.
Oh,
It's a
okay.
mandatory service that we're required to do, but it's not funded. It's never been funded at
So it's an
100%.
unfunded mandate, right?
Right, so a loss of 30,000 is a big impact. We do have an emergency preparedness coordinator, and then we have an epidemiologist that we utilize some of that funding to be able to support. But we were able to recoup that in other ways to be able to keep those positions full-time. In DCFS, we knew that we were going to have some grants that were going to be ending, and we were able to, thankfully, because of the reduction of the cost of the institutes, we were able to recoup the dollars for that as well. In economic support, things aren't as clear. There's a lot of unknowns about some of when things are going to go into place for the Medicaid rules and when they're not. We went with what we knew. A lot of the things that were proposed in the president's bill don't even go into effect in 2026. So we didn't have to deal with those. There's an administrative cost that we're a little bit worried about, but we are hearing that the state might be able to help contribute to the cost of that. So we were able to roll that into this year's budget too, with, you know, hoping that it's the state is at least able to cover some of that extra administrative cost. You know, there are a couple of things that we have to watch. There's an error rate that we can get. The state can get dinged for if our error rate is at a certain percentage. So we are diligently working and putting some things into place in the 26 budget that will help us keep that error rate as low as we possibly can, so we don't have any of those issues. Other than that, our other divisions have been pretty stable. We're not hearing much, if anything, from the federal government or the state government about any other reduction in costs. So that's the update I have.
How does the error rate work anyway?
Dustin.
Yeah, what is, you forgot to cross a T or dot an I or what?
Kind of.
Yeah, it's isn't fraud. It's basically, just, entering wrong information or the client gives incorrect information by accident.
Okay.
It's an active error rate. In federal fiscal year 2024, Wisconsin was fourth in the nation at 4.47%. Currently, we're not doing as well. Well, we're still better than most of the states. And that error rate, the impact isn't supposed to take place until federal fiscal year 2028, but they're using federal fiscal year 2025 or 2026 to use for your
As a benchmark.
as a benchmark.
Yeah.
So the better of those, so that's why DHS right now is really trying to get us to get that error rate under 6% by, federal fiscal year end September 30th. But then we do have another year to do it, but you don't really want to gamble on the next year.
Right.
When we were talking about, millions of dollars.
What's a good error rate other than zero, which is probably
Under 6%,
impossible?
Under 6%.
Okay.
But I can tell you, less than 10 states ever make that number.
Oh,
So.
so
Again, some of that is outside of our control. If the client gives wrong information,
Yeah.
we
Yeah.
aren't able to control that oftentimes. So some of it's out of our control. And the ones that are in our control, we are doing our best to make sure that we're doing lots and lots of training so that those errors don't happen.
makes sense.
Yeah, it's a whole state rate, the whole state of Wisconsin. So there's
Oh, it's not county.
11 state consortiums, counting Milwaukee. We're WQFP, which is Kenosha and Racine, we're the only two county consortium. Right now, and they give you information so late in the game. So the error rate isn't solidified for federal fiscal year 2025 until June of 2026. So you're almost a whole year behind when they can certify what your actual error rate is. But ours, from October through February, because that's the only official information that we have so far, is 3.62 for our consortium. The state is 7.40, so that means that the other consortiums are higher, obviously. But if we do good and Northern does poorly, it still impacts the whole state. So it is a whole state issue.
Interesting, thanks, appreciate it. Any questions for Rebecca on any of the financial information? I know we'll be talking about this more over the next couple months. I know that the CIP budget is coming out in September, I believe. And the final budget, early October, when the county exec makes her presentation. Maybe late September, I'm not sure.
It's usually early after.
Yeah, so things are still, if anything comes up, let us know. Keep us
Absolutely.
top of what's going on. Thank you very much. Let's see. All right, the WINS grant presentation. Dustin, you have the floor. Give us an overview of what's going on there.
Yeah, so I'm just making sure that it's, okay, so I first of all, I want to thank you guys for serving on Kenosha County Board and the Human Services Committee and Youth and Governance. So thank you very much. I'm Dustin Feeney. I'm the Director of the Division of Workforce Development. I have Laura Irvin here. She's the Kenosha County Child Support Services Manager. So we're really excited about this grant. It's been more complicated than we expected. And it's basically Wisconsin's Network for Safety and Child Support, and it's serving survivors of domestic violence in the child support system. So a little bit of background, I started in child support 25 years ago, and I think we knew that, domestic violence was apparent in our caseloads, but we never probably realized it was as great as it is. So here's just our why we pursued the grant, why we're doing the work. Child support's core mission is financial security for families. So we establish paternity, we establish court orders, we establish orders for financial orders, as well as for health insurance. We enforce those orders either administratively or judicially. We have employment programs like Elevate and Children First to help payers pay those child support orders, get them job ready, get them training, things like that. One thing we didn't have is how do we serve domestic violence survivors? So one of the primary reasons domestic violence survivors stay with or return to an abusive partner is for financial dependence. So I think the percentage, I sent you guys a handout too. I'm not going to go over that, but I think it said 67% is the reason that they stay with their survivors by financial dependence. 78% of survivors indicated that public benefits are very much important for being able to provide basic necessities for the family. Also, 13% said it was somewhat important. So over 90% said it was at least important that they had public assistance to provide basic needs for their family. This was one of the things I heard 3 years ago when we first pursued the grant. 93% of domestic abuse victims would pursue child support if they could do so safely. I think I was here last year. I touched on this grant a little bit, and that was probably, I'm sure it's usually the thing I use because it was mind blowing to me to know, and working in child support for so long and people closing their cases because they get good cause. And I'll elaborate more on that later. If they thought they could go through the process safely, they would pursue it. And that's because, stuff goes through the courts and information gets released and there's a lot of hurdles and a lot of things need to happen so that all those safety measures are in place. This statistic, more than 1 in 3 custodial parents report domestic violence with the other party by the time their child is 3. So that's non-marital. That's a study in Texas. So I'm thankfully Laura put this slide together. I had contacted her today. I said, where did you get that? I want to make sure I know where it's from. So that's a study in Texas for non-marital births. 1 in 3 parents before the child's 3. I thought that was really high. I thought I needed to be able to explain that. Abuse victims are less likely to cooperate with the child support process. In our time, we don't need statistics to know that that's true. And triggers for domestic violence. It could be the birth of a child, definitely establishment of a child support order, or when they get served with papers to go to court Enforcement activities could be administrative, could be judicial, it could be contempt, a modification, all those things are triggers for domestic violence. And we're more aware of that than we were 5 years ago. Oh, the power control wheel, so now I'm not going to get the thing on it. So, we are not domestic violence advocacy specialists. We know that. We've learned a lot in 2 years, but we were introduced to this many times. But in the last couple of years during this training, one thing they indicated is when most people hear the words domestic violence, they think of physical or sexual abuse. Some abusers never physically attack their victims. They may use threats, shame, insults, and then isolation. Abusers also use resources to control by denying access to money, a car, telephone, or legal documents, making it hard to leave or stay away. Abusers can use threats about their kids, about the custody of their kids, or child support as a way to maintain control. We also know that another thing is reporting to DCFS to do a wellness check when really it's not needed. All those things exist in trying to control their partner. So again, I touched on this last year, but just to kind of catch us back up, there's a competitively awarded grant was the Safe Access for Victims Economic Security Demonstration Grant through the Office of Child Support Services. That's the federal child support office. So Wisconsin did apply for it and received that grant. 12 states were awarded it, and 1 tribe. Interesting enough, it's Lakota Ray in northern Wisconsin was the tribe. They are very innovative. I've gone to a conference where Sue Smith, the director of Lakota Ray, has talked, and it's pretty amazing how innovative they are in tribal child support, but that's probably for another time. So, the things that it's to do is that address the existence of domestic abuse in our caseload, address underreporting of DV in the child support system. So we have participant protection in our system. At the federal level, it's called your new one's gonna forget something, right? Family violence indicator. So we have it on about 8 to 10% of our cases. They say there's probably 37% of our cases actually have domestic violence. So we know that it's underreported to us and in our system. And part of the grant is to develop, evaluate, and implement model practices to increase safe access to child support and parenting time services. And once we get to Laura's portion, she's going to elaborate on that much more, what we've done so far, but there's so much more work to do actually. So in Wisconsin, it was also competitively awarded. We had to apply to Wisconsin to get the grant. And the 3 counties that received the grant were Kenosha, Brown, and St. Croix. And we've been working together as sites. The other states, many of them are state administered and state operated. So they don't run off of county child support programs. They're regional. A lot of them kept the money right at the state level. Wisconsin is probably in the minority. Other states have done it. I know New York did. They dispersed them to actually county sites. So the people, where the rubber meets the road basically. So we're actually implementing a lot of these things.
How much is the grant, Dustin?
Well, maybe that way. They awarded an initial amount. It was like 216 and then 60,000 and then 33,500 in years 3 through 5 each year. But you have to use it to lose. If you don't use it, you lose it. We did not spend any of the money in the first 2 years. We're supposed to get rollover for the grant. What I wanted to be careful of is that there was enough money once we implemented everything that we were able to maintain the person that we hired. I'll get into that in a little bit. So it's about 310,000. We won't spend all of it, to be honest with you. We'll spend a good portion of it, but also didn't want to run out either in the grant period. So back on that. So yeah, some of the priorities for the sites were to increase participation amongst DV survivors in the child support program, a better response to good cause, and to look at our policies and procedures. And I'm going to talk about good cause in the next slide because they're probably like, what is that? Identify pain points in our current processes. So we did a really good job. We had a session of identifying pain points in our intake process when it's paternity establishment or court order establishment. We probably have other areas we need to move that to, but we're still working on improving all those processes. A greater collaboration with our courts to deliver enhanced safety services. So I will say that most of our cases go in front of the family court commissioner. It's Commissioner Smathers currently. It was Commissioner Pfeiffer. We had a great working relationship with Commissioner Pfeiffer. We do Smailers too, for a long time. And we did make her aware of this grant. So much so that, we nominated her for the Wisconsin Child Support Enforcement Association Judicial Officer of the Year. And we presented it in December and she left in January. So, we have had our lead attorney talk, about the grant to our current family court commissioner, but we are going to give this presentation or an informal version of it here in the coming weeks. So we were kind of waiting to get this all up and going on our presentation stuff, and also to make sure that she had been on the bench for a few months. So also, one of the big things is increased training for our caseworkers. We had a training with Office of Child Support. Can't remember, it was December, February 23 and 24. They only allowed so many individuals in that training. It was a 2-day session. It was remote. And it was really, really good for our workers. We also had the state come down. They do this automatically, the Bureau, actually I can't remember what they're called, but they came down and gave a domestic violence awareness and child support process or something like that. A full day presentation on at Bristol. So we had all our staff there. In a couple of weeks, we're having the SAVE Center, which they're providing the oversight of this grant. They're out of Denver. Kind of like the Institute on Research for Poverty out of Wisconsin would for a grant. They're doing the oversight. They're going to do a training, a 2-day training for our staff later on this month. And we've also done a lot of in-house training that as we've learned, we've provided training to our caseworkers. One of the other things is lived experience. They just finally had their first meeting. What they've learned is getting a domestic abuse lived experience panel is very difficult because people don't want to relive the experience, although we do want their feedback on what we're doing. But the state finally just had their first one a few weeks ago and they have another one planned. So we're happy to hear that. And obviously just policy development, implementation, updating of our documents. You're going to learn more about the updating of our documents when SPOR goes. So, right? Is that where we are? Yeah. Okay. So doing this is kind of the child support process. So I talked about Laura, I called Laura this morning and I said, what did you
I threw
intend
the
on that?
slide together for
You read.
50%.
So, and I'm thankful for that, but I was a child support specialist in paternity and court establishment for 10 years. So the process is most of the cases we get are because someone applied for public assistance and they're automatically referred to the child support system to cooperate. So back then we would set them up with interviews. Now it's mostly questionnaires and phone interviews. And we try to reach out to them in several ways of communication. And a lot of times we get many individuals that never respond. So the standard operating procedure is to sanction their benefits. What that does, that can shut down their childcare. It can shut down their TANF at the federal, it's W-2 in Wisconsin, and it can close the primary caretaker, usually the mom's medical assistance. So that's their option. So they have, if there's domestic violence and they ignore the child support office, they would get their benefits sanctioned. There's other reasons why people don't cooperate too, and it's just the standard operating procedure. So, but there is something in there that they can claim good cause not to cooperate. And the good cause is if they feel like them or their child is in imminent danger or harm, such as if they have a restraining order, there's criminal charges, or there's some testimony that they will give as to why they feel they would be in danger if they cooperate with the child support program. What that does is that will keep their benefits open, but they won't ever go through the child support process. So, one is non-cooperation. They lose their benefits, but they don't go through the child support process because they don't want to. So they don't get the benefits that they need, and they don't get financial money through child support. The other is that they get their benefits if they get good cause granted, and then they still don't get that financial stability of their child support. So what we're really trying to work towards is providing as many safety options for our customers and education to them, customer-facing documents to educate them on what things we can do for them and how we can let them navigate the child support program safely and really allow them to choose. And there's a lot of federal laws and state mandates that we still have to consider, but we're able to maneuver this a little bit differently. So, what we would prefer is, or what can happen is, if their options could be, maybe they want to apply for good cause, but in 1 month, they change their mind, in 1 year, 5 years, and they could still pursue child support in the future. Or they could try pursuing child support, then they don't feel safe and they could apply for good cause. So those are the kind of things we're trying to do so we can, one thing, there's a couple different ways you can look at it. First of all, we're creating some kind of financial independence for the customer. Another way, we're getting more cases, so we get more financial reimbursement from the federal government too. But ultimately, we're helping to serve that family, but we're trying to make it their choice. So, that's kind of the main thing for it. Okay, so this part right here. So in Kenosha, we struggle with what we're going to do or what we're going to work on, who is going to work on it, and who had the time really to work on this grant. We discussed training an existing child support team member on working with domestic violence survivors, to hiring someone with domestic violence advocacy experience and training them on the child support program, to contracting with our local domestic violence advocacy center to provide training, input, and partnership. We initially partnered with our local advocacy centers and gave presentations to each other on our programs. We held a meet and greet with them and even worked with them on some of our safety documents. Then our local advocacy center, Women and Children's Horizons, had a prolonged leadership vacancy, partially closed their doors for a time, and completely lost out on any of the VOCA funding. It was reduced, but they lost out on any of theirs. So this was right in maybe the second year of our grant that we tried to work with them, and it was unresponsive at that time. We collectively decided that we wanted to hire somebody with a DV advocacy background in our child support program and teach them about the child support program, because that we knew. We finally hired our child support safety specialist coordinator, Stephanie Workus, in December of 2024. Stephanie came to us with almost 5 years experience working with Women and Children's Horizons. This helped us with training, local connections, and establishing a culture of support when working with survivors in the child support program. So, the things that we were already making advancements, but what she could continue to help us with is to help survivors and address their barriers to cooperation, to facilitate trainings for serving survivors, to assist us with developing, monitoring, and maintaining internal safety processes, and provide suggestions for service delivery, program development, and overall performance. One of the things we had to work on with one of our supervisors is developing a welcome letter to improving our safety screening document, which we did have, and it was part of we were one of the few counties that had a safety questionnaire that we used, but that's been improved. And also conversational guides that we could give to our workers so they could use that script. And eventually after using that script, it would become commonplace, and that's how you work with survivors. Our idea was to have this safety coordinator help triage cases with workers and supervisors, and then also develop and monitor a tracking system for domestic violence screening. So I'd be remiss if I didn't mention, also we have a child support supervisor, Shalonda Black, that has created a lot of these documents. She's kind of our document creator, but Stephanie has helped her along with those as well. And now for about 5 or 6 months, we've been tracking a lot of the safety questionnaires that we've received back. We don't receive a lot back. That's just how it goes. But the ones that we've received back can be impactful with how we communicate with them and how we impact their case. So, the thrust of having a safety coordinator was to improve our service delivery for survivors by providing training and education to staff and improving our overall services to address survivors' unmet needs. So now I would like to turn it over to Child Support Services Manager, Laura Urban.
Thanks.
Or do you want to sit here?
No, that's okay.
Just the mom.
Yes. Okay, so he mentioned training several times, and what happens is we've got, 40 employees who are now dealing with domestic violence, aware of domestic violence every day, and don't have previous training in domestic violence. They're not social workers, so a lot of what we've done in the last couple of years is take advantage of the trainings that Dustin has mentioned, as well as have Stephanie do trainings, smaller group trainings with our with our support specialists, and taking advantage of a lot of different trainings that we've been able to find across the state and the country. So one thing that we really needed to do is teach our specialists how to recognize domestic violence. It's not always obvious. You don't get a phone call and somebody says, he just beat me up last night, so they need to know. We don't have, over the last number of years, things have turned more not face to face. It's just the way that it's gone. Then we had COVID. So there, a lot of our younger clients like to communicate by phone, communicate by email. We don't have a lot of face to face. So you miss out on some of those cues. So really we have to kind of go through now, what are cues of somebody who is a domestic violence victim? What are signs, what are patterns that you can pick up on that they are not cooperating for a reason? Also then, now that we've taught them how to pick up on it, what do they do with that? Because they're, again, not the advocates themselves. So we had to work with Stephanie, work with the state and the Safe Center to give them tools to know what to do when somebody does disclose domestic violence to them, to be able to have resources available to give to those clients, where they can get support that we can't offer in child support. Also increase their confidence in having these conversations. Yes, we have awkward conversations with our clients as the child support agency. We're asking them who they had a child with, but we're used to that. We're not used to asking them, are you safe in your home? Why aren't you cooperating with us? What might, cooperating with us do to your life? And so we've concentrated on a lot of training with that. And also, we've worked on identifying safety options. So a lot of it's out of our control. Once the court gets involved, the court gets to make the court's decisions. But the things that we do have control over, or the things that we can support, we have identified and we continue to identify because we want to, create as much safe space as we can. Oops, I never went to that slide, but that was our goals. So the next one is this, and this was developed by Shalonda, our paternity establishment supervisor. It really takes a lot of buy-in from our caseworkers, who back in the day were called investigators, and that's what they did. They investigated to find out who the father was. And it didn't take a lot of finesse and a lot of nuance and a lot of building a relationship. It was more of a trying to uncover a mystery of, who they may have had a child with. So she came up with this, which was really good for our specialists to, just a really good visual of the different roles that they have as a specialist and the different hats that they wear. One of them being listener, fact finder, navigator, and then investigator. And really what we wanted to concentrate on is starting from the beginning to build relationships with our clients. Instead of jumping right into the nitty-gritty, trying to make them feel comfortable having a conversation with us and disclosing to us what their barriers are and what the issues are. In order to assess their needs and their concerns, you have to have conversation. And so just trying to get them to understand and put themselves in the shoes of the clients, and get them to where they're ready to move forward safely. And then after that, after you build a relationship, that's when you can get into more of the navigator and investigating, where you can question statements after you build that relationship, and you can research and you can analyze and do different, find discrepancies. Everyone is not straightforward with us. I should say not everyone is straightforward with us about who the father of their child is. Some don't know who the father of their child is. Some have a reason for not telling us who that is, or they don't want an order established. So at this point, once we have the relationship, then we can provide resources. We do have a good relationship with Women and Children's Horizons, which we can refer them to if they are in a time of crisis and they need somewhere to stay and they need to flee. And also we have the resources that are available in the community as far as housing, economic support, the things that they need to support them. We do explain cooperation and non-cooperation, and also we do still have to apply our policies and our timelines. We do have federal timelines in which we have to establish orders and establish paternity. Through this grant, we are able to be a little bit more flexible with those. We'd rather have somebody be able to go through the process safely and get child support than meet that exact 90 days or 180 days or whatever it is. So being part of the pilot of this allows us to get flexibility and see if that, results in better cooperation. Okay, so then the next one, this was developed by the The Winds Group, and also our safety coordinator went through it and adapted it a little bit more for us. And we provided this to all of our specialists. It's basically a what helps during conversations with survivors, and then we've got a what hurts during those conversations. It really has the very first thing says you have to learn to be comfortable in having an uncomfortable conversation. This is not easy for everybody. Some workers, this comes very easily to. Others, this is very hard. This is a hard subject to have conversations with. We provide them with as many tools as we can. We also provide them with support through supervisors, through our safety coordinator, who is willing to jump in and triage a case and talk it through and deal with that client if they have that need at that time. Really stress active listening, slowing down the process, slowing down explaining the process, slowing down the requirements, not a lot of, you have to do this, I need this by tomorrow, understanding that they're in a situation that they don't always have control, they don't necessarily have transportation, communication, freedom, that kind of stuff. So really kind of flexing the process. Also being really mindful of our tones, our words. We have these conversations every day. Our clients don't, and we have to, make sure that we're explaining things in a very clear way. Let's see what else. Also really important down there towards the end is that we do want them to feel like they have a voice in what's happening in their case. They don't necessarily have complete control over it, but we do take their desires into account as much as we can and try to accommodate what will make them safe. With the what hurts, basic things like minimizing or dismissing their experiences. This one, the second one, refraining from blaming or judging the survivor for their experiences or decisions. It was a real learning thing for me just coming to child support 10 years ago, when you'd have a client who had a very difficult experience with a significant other and then were pregnant again with the same father. And you thought, I've just dealt with you for the last 2 years trying to get this person to pay. He was the worst person in the world, and now you're pregnant again and you haven't, and so taking away that judgment of me knowing what's going on in their life and why they might have been back with that person, and it could be a domestic violence situation and they're dependent on them financially. Not telling them that they must cooperate. We do give them that choice. It is very important if they want to go the route of good cause. We don't convince them otherwise. We let them know that they can change their mind at any point in the future, and we're here when they do. If they do. Good cause is the best option for some of these cases. And that's their choice. Also, we make sure that we maintain strict confidentiality regarding their disclosures. This is not something that we openly talk about in the office. If it is something the caseworker needs help with or advice on, we do meet one-on-one or in our local WINS group to kind of talk through a situation and what might be the best option for a client. And also, we cannot guarantee their safety. And, we need to not take that on ourselves and not claim that we can. We will do our best to help them be safe, as safe as we can, the things that we have control over, but there are limitations in our program, and we have to be honest about those also. So a couple of the things that we've drafted here is, this is a welcome letter. So as Dustin said, these people, most of these clients have applied for benefits. They want health insurance, they need food share, that kind of thing. And very briefly touched over as they're applying for those benefits is that they have to cooperate with child support. So before this, they were just getting a letter in the mail that said, this is when your conceptive period was, what time, who did you have sexual relations? No, like, hi, I'm Laura, nice to meet you, and this is why I'm asking you. So just jumping right in there. And most people, the first time they're going through this, this is very presumptuous that I'm going to tell you this, why I don't want you involved in my life, and who are you? So we started with this welcome to Kenosha County Child Support Services letter. We email this if possible. If we have an email address, we mail this to them. This is their first introduction, really explains why we're involved at all, who we are. It also identifies all of the documents that they will be receiving, the ones that they'll have to return. Also, we do it on here include on the very bottom, it has the National Domestic Violence Hotline, so that we include this on most of our documents, especially as we are starting a new case. And introduces who their worker is, who they can contact directly, so it's not just a general phone number, they've got to call and leave a message, they get their direct number for their specialist. So this goes out immediately to them, and then following this, it also does explain what good cause is, and if they think good cause is the option that they need to pursue, that they should reach out to their caseworker and have a conversation. Otherwise, they can just mail the good cause paperwork directly into economic support without ever having a conversation with us. So we do really want to stress, hey, have a conversation with us. We'll let you know maybe what we can do, because we don't want everybody to think good cause is their only choice for multiple reasons. But then when we send the paternity interview form, when we send the information letter to the custodial parent, we also send this safety questionnaire. This is our screening tool here. And it's we really thought over these questions. We worked with the state, with our WINS group. We had a survivor on that group that kind of gave us, that works for DCF, that gave us some ideas of ways to frame these questions so that you kind of cover every base. And this is what we send this out on all of our new cases. We track our responses. We track whether they said yes. We track whether they said no. If they said yes, did they pursue child support safely? Did they opt for good cause? So we're just in the process of starting to collect that data. But basically, it asks things like, is there anything that frightens you about working with child support? They could say yes, and it could have nothing to do with domestic violence. It could be, I think you're gonna arrest, like people associate government as all one big thing. I had a bad experience with the police, so I don't want child support to be involved. Do you have any concern for you or your children's safety? Are you fearful of the other parent? When you're meeting with the other parent to exchange your children, are you concerned for your safety? We talk about participant protection. So if your information, your name, your address were to appear on court documents, would that be concerning to you? If you have to go to meetings, court hearings, appointments, and you had to have contact with the other person, would that be concerning to you? Do you have any other safety concerns we have not addressed? And the last one is, what would you need to have in place for you to feel safe enough to work with child support to establish paternity, get a financial order, medical order? And that's because we can't presume that we know everything that is somebody's obstacle or that would make them feel safe. So we wanted to have a open catch-all at the end where they could voice something. And if we have control over that, we can provide that. That also contains the domestic violence hotline information on there.
When you mail this out, you don't know if the abuser is going to be the one that opens the mail.
Right. Correct.
One thing we learned is that nothing's perfect.
Mhm.
However you formulate your safety questionnaire, even calling it a safety questionnaire. But we want to do something and we can always improve upon it. But yes.
Yeah, we send it to every, so what we'll say is this is a standard, this is a standard form. It goes to everybody. We are looking at incorporating into this. Well, we all want to put in there, what is the best way to contact you? Right. Unfortunately, that has to go out to them in a mailing first for them to say maybe mailing isn't the best. And even then, there are forms that come directly out from the state from child support that we have no control over. We can never guarantee that they will never be mailed forms from child support. We can ask how they would prefer, and we can try to communicate with them by email, by text. Yeah.
Supervisor Norton here.
There are other ways to get information out so they could see it and then address it, as opposed to waiting for a mailing to come in to address it. more of a push than a pull.
Yeah, we do have some postings in our county offices. We want to get, and I want to do a disclaimer too, because we just met with Sue Sippel from Women and Children's Rising 2 weeks ago, and she's making great improvements. We're reestablishing that relationship. She's getting our flyer that has pull tabs on it too. So we want to get those out in the community where people
How about
contact us.
social media?
Yeah, social media is,
Social media. Child support is
doesn't do real well on.
on social media.
You know, you'll see the, Kenosha County executive will put stuff out, you see, that's all I'm saying.
Yeah.
It's put, hey, did you know type stuff, hey, did you know, Kenosha County also, why can't we look towards that as a push medium, as so we not, you know, how many do we have in the system right now?
Well, it's about 11,340 cases, so that's families.
Yeah.
About 8,000 non-4D cases. Those are ones that are kind of closed out, but we're still collecting child support on them.
Yeah,
So yeah.
there's a lot out there, so, yeah.
And more coming in.
Well, on the right, there is safely obtaining support that the state came up with. That's a DCF, state DCF form. We do have that posted throughout our building, out of the county center, and we also put full tabs on the bottom of that so anybody in those buildings, this could be before they apply for services. This could be 2 years down the road. They could, so we physically have that. We do want to get that out to more locations. It does tell them, if you go up to the desk and say SOS, that means safely obtaining services. That's a cue to us. That was something that the state came up with. So we need to have conversations with the people, the places where we put them, so that somebody doesn't just walk up to somebody at the library and say SOS and they're like, what does that mean? Yeah. So,
Supervisor Robinson, your question?
Yeah, first of all, as a social worker who worked with domestic violence, I'm liking what I'm seeing. So, that's really neat. Do you have this in any other languages besides English?
You're working on that, right?
we have the Go Safe flyers in Spanish and Hmong.
Yeah, well,
The SOS,
no,
sorry,
that's the
the SOS.
last one, if you go back. This one is in Spanish and
Hmong.
This one is in Spanish and Hmong.
And the welcome letter, we're working with the state to have it translated to Spanish.
Yes.
Do we know what languages are most prevalent in Kenosha County? I mean, I would assume Spanish, but
Spanish.
we also have some other
Yeah,
languages.
in monitoring the call center for economic support, it's Spanish.
Okay,
Then there are some,
right.
that we use, we use the language line.
Okay.
I just signed for the bill today, and then now we changed to Propio because we're getting a better deal, and we're making that conversion, but, it's predominantly Spanish.
Okay.
It could be
So-
Russian.
There is French, there is Mandarin.
What's the?
I was gonna say, so could, one of the things that I was seeing was, is there a better language?
Right.
Is there a language, having a question of, is there a language that you would
Okay.
prefer to communicate in? Because
To a certain.
exactly, then that allows you to say, okay, maybe this would be a better specialist, or, like, I ended up getting pulled in a lot of times for French, so,
Okay.
what would work for you? Yeah,
Okay.
And we do have, as an intake worker, we do have a Spanish speaking attorney specialist, so.
And she's assigned all of the cases that come over with limited English proficiency, so she gets those right away. The majority of those are Spanish speaking clients, and she's Spanish speaking, so that assists them.
Supervisor Kirby, did you have something?
Yeah, so I actually did have a question, and this is kind of from earlier, but since we're all asking questions right now,
Okay.
figure I'll throw it in there. So with the good cause, who makes that determination?
So that is the income maintenance department. So it gets mailed out by us. It gets
Okay.
returned to income maintenance, and there's a supervisor in Kenosha that makes those determinations.
That's by like administrative code that is set forth.
Okay, that's kind of what I was
It
wondering.
goes, it says by the W-2 agency, but if W-2 isn't involved, then it goes to income maintenance. But we have worked with Michael Hayes from the Office of Child Support Services for the federal government, and they have determined that child support, we can't call it good cause, but we can close a case for referral not appropriate, and a reasoning would be best interest of the child. We tend to try to follow the administrative code unless, I made a rule, expediency and severity.
Mhm.
If the urgency or expediency of it or the severity of it is high enough, we will just make the determination, put a note, it's a closed case now. There, I can, and I don't want to get into what the scenario was, because you'll know what I'm talking about. But you know, where there's huge crimes here in Kenosha, where they have children, where we have a paternity case. And the person said they wanted a good cause, but never filled out the form. Well, they're in the hospital. So we closed that case for urgency and severity of the situation. And we use, and that we're, based on this grant, we learned from the federal government that it's allowed. That's contrary to what most counties do in Wisconsin, because they follow the administrative code. Now, I also, luckily in Kenosha, I also am the director of economic support. So I supervise the supervisor that makes the determination. So we've also set in something where, hey, this one's fast tracked. We have a court case filed, or court date coming up. So we can do that too.
Thank you.
We've also had our safety coordinator reach out to people who have claimed good cause, because sometimes they'll just submit the forms and maybe it's not a clear case and we need somebody to have another conversation with the person, and we've had our safety coordinator have a conversation with the person to kind of get at what they're really looking for. So that was our Go Safety flyer. We send this out also with the initial paperwork. Basically, it highlights some of the things that we can do there for their safety, gives them a voice in how their case is managed. We do have a good relationship with the courts. We request, we just send an email request over, and they'll have a deputy present for a case if we ask for that, and the deputy will just be present in the court. They will also, if needed, escort the person out of court. We stagger the leaving times, so the deputy can walk the person out to their car, and the other person has to stay in the courtroom for 10 minutes or something, and the other one's able to go. We have participant protection that protects all of their address, confidential information in all of our filings in that case. It's not as complete, I would say, as expansive as Safe at Home, but we also are looking at our safety coordinator is the Safe at Home applicant. I forget what they're called. She is able to do that. She was in her previous position, so we can direct them to somewhere else or potentially facilitate that also, because that would protect their address everywhere, across all of the court records. And that we schedule them for genetic testing separate. So this just highlights some of that information as to what we can do to do that safely. Some of our local wins accomplishments, for us, a big, huge one was the hiring of the support specialist. It's just been really, really valuable. We put a quick escape button on our website, so if anybody is searching for Kenosha Child Support and they're researching it and they hit the quick escape, it will bring up like Amazon. And even if you hit back, it doesn't go to the Kenosha County website, it goes to Google or something like that. So we had that established right away. We've got the expert informed training, looking at the cases through the DV lens, triaging domestic violence cases. There are things that happen every month that I thought, man, never thought of this one. And as a group, the lead attorney, supervisors, our safety coordinator, me, Dustin, will go through the case and kind of brainstorm, what can we offer this client? What is the best offer? How can we, what can we support them with? We collaborate with Economic Support on Good Cause in Kenosha. It's a fantastic setup. We have a great relationship. Other counties are very hands-off. They don't have any relation where they're conveying information or supporting that. And then all of the things I showed you, all of our letters, the screening tools, and also this safely obtaining support, which I mentioned to you before. So that is something that we have out there with tear-offs, and also are looking to expand where we're sharing that. And then that's just our team. So it is the lead attorney, Dustin, myself, 2 supervisors, and our safety coordinator. That's our Kenosha team.
Cool, thank you. Any final questions, comments? Well, yes, Supervisor Poole.
Yes, do any of these funds go to the clients, or it's just all to run the program here?
It's really just to fund those staff position. Yeah. There's some training portion of the grant. So that's basically it. Yeah.
Okay, thank you.
Anything else? No? Well, thank you very much. I appreciate it.
Thank you.
Thank you for your time. All right. So, let's see, we have a resolution to accept the Vital Strategies opioid settlement match grant.
Yeah.
Okay, Rebecca, you
Yeah.
have the
so-
floor.
Carrie Foss is here as well. She is the director of our behavioral health team where this grant will live. This is a grant that we applied for. WCA had all sorts of information out about this grant. It's through Vital Strategies, which is a national company. And it's an opioid match grant, meaning that whatever dollars we were willing to match up to $100,000, they would contribute that and we would use our opioid dollars to be able to support that. So they had a couple of suggestion of things that we could do. We really used our, we talked about this before, but we had Kane Communications come and do that follow-up survey for us and put together all of that. So we picked some topics that we saw that were things that Kane had recognized as a need in this community. And we came up with 2 solutions. One of them, Kane had highly recommended that we work on kind of consolidating our information so that it was coming out of, the same information was coming from all of the sources. So we're going to work with Kane again to be able to do all of that and provide it to our providers so that we're all speaking in the same language, that we're all saying the same things, that the information going out is the same, the knowledge is going out is the same, and that we're giving our community the same exact information and they know where to go for help. And then the second part of it is that we are going to plan to, if this grant is approved, we plan to hire a 1.0 navigator. And this navigator would work directly with clients that have had opioid overdoses or families of those that have had opioid overdoses. It's kind of similar to what we've been doing with our SAMHSA grant, but our SAMHSA grant is sunsetting. It ends in September, and we're still collecting all of that data from our fire department. They're still sending us over overdoses so that we can follow up with family members. This navigator will be able to continue that work because that was certainly great work that was done by our health team, but they will also be able to expand it. So they'll be able to work with people, whether it's related to housing, whether it's related to economic support, whether it's related to anything that they need, they will be able to help them navigate the services and resources as they work through the recovery process. It'll be open to not just people with overdoses. I mean, we certainly want to expand it beyond any overdose or any situation where there's substance use, and we can be able to have our navigators help with that. We are going to have that housed in our behavioral health team to be able to work with some of the other things that we have there, some peer support, some of those things along the line, and then connect with our community providers in particular to be able to establish that this person is available to connect with the people that they're serving as well. So that's the plan with our grant, if it's approved, and we look forward to your support. Thank you.
Yes, Supervisor Nordigian.
Thank you, Chairman. Questions?
Sure.
And it's because I know nothing about this, so
Okay.
no, I'm not trying to point fingers or go, what are you doing?
Yep.
It says here, whereas Kenosha County Department of Human Services intends to hire a full-time 1.0 navigator funded with opioid settlement dollars as the match. How long, is this only a 1 year?
The grant is 1 year, and our hope is to continue if this grant is successful. Of course, it's always going to be based on the success of the grant to continue to fund it with opioid dollars.
Well, so we're gonna continue, I know we're supposed to get more
Much more.
opioid dollars. And so when that runs out,
Well,
now, again, I'm okay with funding for any substance abuse or
Sure.
anything like that to try it out. But are we gonna get caught in the opioid? It's gotta be opioid.
so there are some funding sources that we're receiving for an incredible length of time, 10, 12 years. So we certainly believe that we would be able to support this program for that long, as we're continuing to have funds. We also have a pretty large chunk of change in the bank. I think it's close to 4.2 or 3 million.
We're expected to be getting funds through 2038. The expectation with this position is to use this match as the pilot to see how successful this could
Sure.
possibly be. Understanding there's also rules coming through DHS to be promulgated to be able to bill peer support, certified peer support specialist time to Medicaid. So as we're amping up and using this pilot, we certainly hope to be able to actually generate a revenue stream to if and when the individual we're working with also has Medicaid. So we would be relying pretty heavily on our opioid dollars, knowing though full well opioid dollars. There's a lot of language in there that doesn't necessarily mean it has to be for that individual that is experiencing an opioid disorder in the moment. It can be used for anyone that has a substance use or mental health
Okay.
diagnosis that they are likely to develop. So
Right.
there's a lot of prevention,
Okay.
there's a lot of spirit of prevention in the opioid
Right.
dollars.
It's great to give help to those who need it.
So we're really able to cast a much wider net and to have a deeper effect, hopefully being able to kind of transition from the foundation that public health has done with the SAMHSA grant, that was really dedicated to opioids, to now really expanding this to a much larger population.
And how did we get surplus of $2 or $3 million and?
We received some Johnson, when the Johnson settlement came through,
Yeah,
they paid a
yeah.
significant amount.
Oh, okay, that's all from.
Yep.
Okay.
So that's surprise.
I was
Yeah.
gonna say,
No,
God.
No, and supervisor, we have a opioid dashboard on the behavioral health webpage that will show every penny that has come in and every penny that has gone out.
Mhm.
And
I think I've
you
seen
can
it.
also find a link to the state's opioid dashboard that also has some projections in there.
Okay.
of Monies to come.
Yeah, I mean, my biggest question was how we were gonna fund an ongoing navigator if it was just with this opioid, grant.
That is a fair question.
And again, we're not gonna continue to fund something that's not
That's not
successful.
necessary.
So I liked Carrie's use of the pilot world. We
Yeah.
haven't said that yet, but I think that's exactly what this is gonna be, a demonstration or a pilot to make sure that this is truly what our community needs. When Kane did their big study, that was one of the things that they were highlighted was that it's so hard to navigate the system there. In Kenosha, we have so many providers and we are blessed that we do. But when you're a person in that situation, where do you start?
So
Where do you
many
go?
choices where to
Right,
go. Yeah.
Right. And a lot of time you're told go there, but nobody ever follows your story,
Right.
right? This person would be able to do a lot of that following of
Okay.
the follow-ups. Yes.
So after the completion of the year, assuming this position is successful, are we gonna basically rely upon future or the incoming, remaining, whatever opioid funds that we have to finance it?
Yes and no. So,
As
yes,
well as some of the other things that was just mentioned, some of the
Yeah.
other sources.
right. So that would be our last resort, is that we would look for the opioid dollars we have to continue to fund it. We are certainly going to continue to look for grants. There are lots and lots of grants coming out all the time related to these things, especially since the state, collected a significant amount of money with some of these settlements and they're putting out grants all the time. So we would look for grants to be able to support it. But we're also, like Carrie said, we're going to really look at this MA match, this medical assistance match that's going to come through. That could probably support the position alone, but not probably right away. It's going to take some time for us to be able to build that up.
Thank you. Any other questions? Don't have it? We're gonna have a vote now. Youth and governance, how do you?
Well, we don't have.
We don't.
No, sorry, we don't even have a motion out. Yes.
Oh,
I'm,
Mark,
Yeah.
yes, we have a motion by Supervisor Brown and a second by Supervisor Kirby. Now we can vote. Youth and governance, how do you vote?
Yeah.
Yay, okay. Committee?
Right out there, right out there. Don't say that.
Committee? Okay, motion carries. All right,
Is it okay if you vote one way and the whole rest of the committee? votes
yeah,
the
that's
other?
perfectly
Do what you
okay.
think is the right thing to do. Yeah, that-
Yeah.
We can still be friends after.
yes.
All the
We
time.
fight, we don't break the. skin,
Okay.
no?
Speaking of motions, does anyone make a motion to adjourn?
Move to adjourn.
Okay, first by Supervisor Nordigian, a second by Supervisor Poole. Youth and governance, do you want to leave? That's adjourning. Yes, you do? You sure?
Dang.
Yay, okay, all right.